all, let me thank you for being with us this afternoon. Hope you're healthy and safe and doing well. And I am so honored to have with us this afternoon my fellow colleague, my fellow Californian, someone who was a phenomenal Secretary of State who came to our district to make sure that every vote was counted and cast and counted and registered. And now, as our United States Senator, has hit the ground running and is doing a phenomenal job. And I want to thank you, Senator Padilla, for visiting with us yesterday in Oakland, which of course is part of your district, California, and visiting our FEMA vaccination site. It's so important that the targeted resources that we, yourself, myself, put into our rescue plan really provides for the vaccinations for those who are medically underserved in the most targeted communities in our communities. And so, of course, Black and Brown communities are where the disproportionate rates of the transmission of the virus and the lack of access and equity in terms of the vaccine distribution are. And so thanks so much for highlighting that and for being with us yesterday, Senator Padilla. Now, let me just say a couple of things about the rescue plan. First of all, I hope that you have received your stimulus checks by now, and those receiving unemployment benefits have continued to receive checks. And our bill, though, well, our law now will go much further. It includes everything from rental assistance to small business and restaurant relief, and even child tax credit, which is a move expected to cut child poverty in half. We've got to make that permanent. If you want to crush this virus and get our economy back up and running, we've got to tackle the public health portion of this crisis. And so this law now makes investments in equitable, fair vaccine distribution and critical resources for medically underserved communities and communities of color to fight the virus, something that myself, Senator Padilla, continues to fight for in all of our packages. We'll also continue to fight for FEMA vaccination sites in Oakland. Again, thank you, Senator Padilla, for being with us and shining a light on that, because it's imperative that we provide equitable access to these vaccines. More than 160 million doses have been administered, fully vaccinating over 62.4 million people, or 18% of the total population. We're well on our way, but we must keep going. We'll get into all of this and answer a few questions that were submitted over social media in a few minutes. But now let me just pass it over to Senator Padilla before we start our Q&A.
Sure. Well, thank you, Congresswoman. Great to be back with you today, virtually, yesterday, together in Oakland, as you mentioned, and several key moments over the last several years. So to all your constituents who are tuning into this discussion, it's great to see you all again. As you mentioned, Congresswoman, in my prior capacity as Secretary of State, the whole state was my district, and we put a lot of work and a lot of good policies in place to make it easy for every eligible person to register to vote and every registered voter to easily cast their ballots. A lot of that work that we did was through the lens of equity, because we know which communities historically have registered at lower rates for a number of reasons, or have voted at lower rates for a number of reasons. So as we've closed that gap on civic participation in California, now in this new capacity, this new responsibility of serving as U.S. Senator, we continue the equity lens, right? As we, over time, will help address access to health care or environmental justice, criminal justice concerns, and so much more. The front and center issue since my appointment to the Senate has been COVID. We know how devastating COVID has been for the country, and California is no exception, but it has disproportionately impacted working class communities, communities of color. So it was great to partner with you and all of our colleagues to push through this American Rescue Plan that you've talked about. When we step back and take our breath, we recognize that it's one of the most progressive pieces of legislation approved by Congress since the New Deal. And so it is tremendous help that's now arriving, not on the way, it's arriving, direct assistance to families that have been struggling, direct assistance to small businesses that have been stretching like they've never stretched before to meet payroll. Some of the other elements of the package that haven't been discussed as much have been things like the expansion of the earned income tax credit. And so anybody who's tuning in right now, we invite you to call Congressmember Lee's office or my office to get more information on how you can benefit from the earned income tax credit this year and next year when you file your taxes. The expansion of the child tax credit, my gosh, that's one of the things I'm most proud of, having a support of this. We have the opportunity to uplift half the nation's children who are living in poverty out of poverty. In California alone, that's 500,000 children that are currently in poverty that can come out of poverty because of the size and the impact of the American Rescue Plan. So it's not a bad start for 2.5 months being in the Senate. It's been trying times, but this is a good reminder that when we work together, the tremendous impact, positive impact we can have on the nation and on the people. So looking forward to our Q&A and discussion this evening, Congressmember. I think the honor falls to me to ask you a question, something that I keep hearing when I do virtual events up and down the state. And that is, as I mentioned, this equity lens and the disproportionate impact of COVID, both from a health perspective and an economic perspective, for that matter, on communities of color. So what else should we be doing to address the disparities in COVID-19 and specifically our vaccination efforts?
Mute. Okay, certainly, and thank you, Senator Padilla, because we've come a long way just in 60 days, but we have a long way to go. Let me just give you a couple of statistics, just so for context. According to Center for Disease Control, African Americans are dying at 1.9 times the rate of white people. Latinos are dying at 2.3 times the rate of white people. American Indian and Alaska Native people are 3.7 times more likely than white people to be hospitalized due to COVID-19. And in California, 21% have gone, of the vaccinations have gone to Latinos. However, Latinos account for 55% of cases, 46% of deaths, and 40% of the population in the state. And so, having said that, what you talked about in terms of the lens that we have to see all of our work through, and that's a lens of equity, specifically racial and ethnic equity. And so a couple of things that I'm working on with Senator Warren and yourself. One is the COVID Community Care Act. And that bill, now I have to say, a large portion of that bill, Senator Padilla, was actually put in, we got it into the rescue plan. But we still have many more provisions that the single legislation would enact. One is it ensures that community-based organizations and nonprofits conduct testing, tracing, and outreach activities in communities with higher rates of COVID-19 and higher percentages of minority residents who have historically lacked access to the healthcare system. The bill also would require that persons hired to conduct engagement have experience and the relationships and are linguistically relevant and appropriate with the people living in the communities that they serve. So the recently enacted ARP, it includes $48 billion for COVID testing, contact tracing, and mitigation activities, as well as for vaccine confidence activities through CDC to combat the distrust in our public health system due to the legacy of systemic racism. And so what we have to do is hopefully pass my bill, which would actually increase the dollar amount of resources, but expand our efforts so that we can address the systemic racism in the healthcare system once and for all. And so we're working on a bill, the anti-racism in our public health system, to really begin to address the structural issues, because if people in Black and Brown communities have suffered so much through our time in this country forever. And it's time that we recognize that and not duck and dodge, not tinker around the edges, but use this horrible moment of this pandemic to say no more, we're going to address the structural issues in our country. And finally, let me just say in this bill, because this is important, we have to expand on this in the future. We did put in 7.6 billion to expand the public health workforce, which is funding and I hope people are listening to this because I want our California and our communities to benefit from it. This funding is to be used to recruit, hire, and train individuals, including those employed by nonprofit, private, or public organizations, to actually establish relationships with the state to deliver these public health messages, the vaccinations, and the public health resources in medically underserved communities. So we're expecting 100,000 new trained individuals to work in the healthcare space in the country. And so that's hopefully something that California will benefit from, because we will then have more jobs being created in the healthcare sector to deliver the types of services, healthcare services, to begin to bring this equity to our communities, which they so deserve. Now, let me ask you, Senator Padilla, what do you say to folks who might be hesitant to get vaccinated? And, I've seen studies that have said, really, we have to look at not only hesitancy, but some say that it's the access issue that's the most critical versus the hesitancy. What do you think, and how's that balance, and how are you seeing this as it evolves in our communities of color?
Yeah, no, that's a critical question if we're going to get to the other side of this pandemic. And I actually think it's a combination of both. There's real sort of trust issues versus hesitancy issues of the vaccine. Is it safe? Is it effective? Is this another government conspiracy? Because we've had those chapters in our nation's history. Versus access, right? We're talking about the Oakland Coliseum site, for example, for a mass vaccination location. As many people have gone there to get their vaccines, that's not really touching every community, because maybe not everybody has a car to get there or has easier access to public transportation to take BART to the Oakland Coliseum, those sorts of things. So, I think there's some short-term and longer-term things to address. Longer term is, why are we disproportionately exposed to COVID? Is because we're disproportionately in the essential workforce. That's a reflection of economic opportunity or lack thereof, or educational opportunity or lack thereof. So those are some of the longer term things that we have to get to. In short term, like I know this is personal for you and me, Congresswoman. I grew up in a community called Pacoima, which you know well. We're both graduates from San Fernando High School. And when Pacoima is labeled the epicenter of the epicenter, it hits home real quick, the impact of COVID. So short term, part of the American Rescue Plan wasn't just funding for vaccinations and distribution and mass sites like the Coliseum, but funding for example, community health clinics and community health centers. That goes hand in hand with, access to the vaccine, but also who the messengers are. It's one thing to see PSAs and those sorts of things, but when your local doctor at the county clinic that you go to for help is telling you this is what you got to do, it's going to be more effective that way. So mass vaccination sites are helpful, but when we couple that with community clinics and that really community-based leadership infrastructure, local pharmacies, those sorts of things, then we're going to get to the communities that are most vulnerable and need the vaccines the most, because they're getting information from more trusted sources, more reliable sources, not all the disinformation that we're seeing on social media at times. So,
thank you. And Senator Padilla, I'll just make one point about what you said in terms of community health centers. In the law now, we put about 7.6 billion for community health centers. And one of the most exciting part is a lot of this funding can be directed straight to community health centers. They don't have to go through the bureaucracy and the rigmarole of going to the state and the county and all the hassles that our community health centers have to deal with. So this is really a breakthrough, I think.
Great. And so, Congresswoman, my next question for you. I talked earlier about some of the elements of the rescue plan that have been covered in the news as much, like the child tax credit, the earned income tax credit, other things that we committed to, not just to get through the pandemic, but try to get at the root of poverty in the country. Can you just share a little bit more on how some of this will continue even after the pandemic is over, or what else we need to do?
Sure, and Senator Padilla, here in California, oftentimes we think of it as the Golden State, which it is, but we have such huge numbers of people living below the poverty line, and it's growing even more each and every day because of the pandemic. Nationally, the crisis has plunged more than 8 million more people into poverty since last year. About 1 in 7 households nationwide, including more than 1 in 5 African-American and Latino households, and many Asian Americans and Pacific Islander households are struggling just to secure food that they need. And so we did a couple of things. One, you mentioned the child tax credit, which will lift over 50% of children out of poverty. But you know what? We have to make that permanent. And I know that you're committed to that, and we're working on that also. So that's one thing we must do. In this bill, we are in the law now, we did put $1,400 in direct payments. For me, not enough. I think we need to have at least $2,000 a month guaranteed until the end of the pandemic. People did not lose their jobs because they didn't want to work. They didn't lose their businesses because they just wanted to shut down. This was as a result of the pandemic. And so our government needs to step up. So $1,400 we provided. Also, rental and mortgage assistance. California is a high cost state. Across the country, 1 in 5 renters and 1 in 10 homeowners with a mortgage are behind in payments. So we took an important step in the right direction by putting $25 billion in rental assistance and extending the federal eviction moratorium. Once again, so many more people now are unsheltered as a result of this. And that's part of the 8 million people falling into poverty. So American families own, and this is really a stark amount, $25 billion in back rent. And the threat of widespread evictions will still exist. And further, more than 10 million homeowners have fallen behind on mortgage payments. So what do we have to do? We have to continue with this extension on the eviction moratorium extension. Yep. We have to put over $50 billion in rental assistance. $5 billion we did put in emergency assistance to help secure housing for people experiencing or the risk of homelessness. And also we put in more resources for SNAP benefits because these food lines and the cars that have been lined up at food banks, it was almost like, is this America? People shouldn't have to struggle, shouldn't have to beg in the wealthiest and most powerful country in the world. And so we have to address the issue of poverty systemically and structurally, because we fight for, and you fight for, the middle class, Senator Padilla, all of the time. But finally, now I think people are really, really recognizing that we have, and saying poverty, using the P word. I've been fighting in Congress forever to try to get our people to use the P word. Well, now poverty is an issue that people are beginning to understand. And so we have to also fight for low income working families as well as the poor, as hard as we fight for middle income families. And that is extremely important as we come out of this pandemic.
Just one more thing on that note before we go to the next question is one of the items that was not in the final package. I know you were supportive of, I was supportive of, argued on the Senate floor along with Senator Sanders to include a federal minimum wage increase in this package. Parliamentary rules in the Senate did not allow that, but the fight continues. If we're going to be tackling poverty longer term, it shouldn't be that you can work 40 hours a week and live in poverty because of low wages. So a great start with the American Rescue Plan, but much more work still to do.
Yeah, and when you look at just the economic impact, come on, look at the amount of money people working and living below the poverty line. They need SNAP benefits, they need Section 8 housing, they need public benefits. And so just from an economic sense, if the humanitarian piece or the concern for your fellow human beings is not what we think it should be, think about the economics of it and what it means to pay people a living wage to take care of their families and not have to beg from their government to help them out in the wealthiest and most country in the world. So thank you for raising that. But we have a lot of work, and California has some of the highest poverty rates with Black and brown children throughout the country. And so this is not something we in California can sidestep. And thank you for taking this head on. Let me see, I think now we're going to open up for a few questions from our constituents on social media. Sean, do you have a few questions to ask of Senator Padilla and myself?
Yes, the first is a question for Senator Padilla on how the American Rescue Plan will impact local families.
Yeah, well, that I think is one of the areas that I'm proudest of. I wish it was a bigger dollar amount for the direct assistance to working families, settled at $1,400, because that combined with the $600 that was approved right around the first of the year together is $2,000. But to Congressmember Lee's point, survival checks, not stimulus checks, for so many people wondering how they're going to put food on the table, how to make the rent, how to make the mortgage. And the pandemic isn't over. You know, we got some encouraging news. Vaccinations are up. Positivity rates in California are down, lowest in the country right now. And the governor's projecting if we keep doing what we need to be doing, the economy can reopen around June 15th. But that's on us now to get your vaccine shot, but then you got to keep wearing your mask, keep washing your hands, keep distancing. Because if we start scaling back the public health measures, we run the risk of another spike and another wave. And the longer this pandemic lasts, then the more economic assistance we're going to need to continue to improve for families and small businesses. So for families that are receiving that direct assistance, you might have gotten it already, either a check or a direct deposit into your account. That layered with the earning tax credit, the child tax credit, the unemployment assistance, if you've been unemployed this last year, all told, has been a huge infusion in the California economy. So let's hope that it's the last or near the last of what we need to get through this pandemic.
Sean, do we have another question?
Yes, this one is for the Congresswoman. Congresswoman, we know women and people of color have been impacted most by this crisis. What's in the plan to help these communities bounce back?
Sure. Well, let me say, yesterday, Senator Padilla and I had the privilege to be with our Vice President, Kamala Harris, and we talked about and went to a small business, the Red Door, in my congressional district I'm very proud of in West Oakland. And we talked about the community investment in terms of the Community Development Financial Institutions, CDFIs. We put $12 billion into those community financial institutions for small entrepreneurs and small businesses and minority and women-owned businesses, such as the Red Door. And I share that because it is so important that our businesses not only survive, but thrive through this period. So many small businesses create the jobs that keep our economy going. And during the first and second go round of our recovery bills, our minority and women-owned businesses were shut out totally. And so we dedicated funding for community development institutions, community CDFIs, community financial institutions, to make sure that they can keep their doors open, but also retain their workers and provide for capital growth and for Main Street small businesses in disadvantaged areas, low-income areas, to be able to continue to hire residents and to provide the services that are so desperately needed. And so we did that in the law. We also put in, we lowered the health insurance premiums for millions of lower and middle income families. That's one part of the law now that a lot of people haven't been talking about. But a family, and let me just quote this, a family of four making $90,000 could actually see their monthly premiums come down by about $200 a month. This will help well over 1 million uninsured Americans gain coverage. And the plan also subsidized premiums for the continuing health coverage, as in COBRA. And so there were many, many provisions of this law that we put in, and when we worked on the legislation. so that we can not only help people save their lives and not get sick from the virus, but also their livelihoods. Because we know that, as Senator Padilla said, and thank you, Alex, for reminding people to stay masked, continue with hand hygiene, and continue physical distancing, because while we're doing a lot better, this is not over. We have the variants, it's still a novel virus, and we're making a lot of progress. And so we cannot be set back by thinking that it's over. And so we have to make sure that we understand that the progress we're making we can be set back in any day if people don't comply with the health protocols that our governor has set in place and that the CDC and the Biden-Harris administration has insisted on. Thank goodness.
And the last thing I want to make sure we covered today, I know our time is starting to wind down, is right. My wife and I have 3 boys, so as a parent, I know how tough this last year has been. Too many Zoom sessions for the kids. We are ready for kids to go back to school, but it's got to be done safely. So again, the American Rescue Plan, providing the resources for state and local governments and school districts to implement not just vaccines for teachers and all school personnel, but to do the sanitizing and cleaning that's necessary to install all the safeguards to keep our kids safe, so that we can reopen schools, but reopen them safely.
Thank you, Senator Padilla, for that, because the pandemic also has exposed the educational inequities in our state and throughout the country. I mean, so many of our young people do not have access to broadband. And so we tried to do something in this law and the rescue plan for that. But so many young people are going to be a year, 2 years behind because they did not have access to the technology needed for distance learning. And so finally, I think we're on the right track. I know we are in California, making sure that schools will be open safely, but also that teachers and administrators and support staff and young people are able to relax and study hard and not worry about the transmission of the virus. But I'm telling you, we all have to stick together and make sure we continue with the proper health protocols. And I'm so happy that our children are finally going to be able to get back to what they love doing. You know, it's amazing. You have 3 children, I have 5 grandchildren, right? And all of a sudden they miss school. They love school now, right? Whereas before, oh, do we have to? Now it's like, when do we go back? So
can't wait. They can't wait, neither can we.
That's true. So listen, let me just thank you again for spending time with us. I know you're awfully busy. You have the entire state to take care of and look out for and work with. And I'm so proud of the work that you're doing and so pleased that you're my colleague, Alex. And I look forward to our continued work together on so many fronts, because you're on, why don't you share, as we close, the committees that you're on in the Senate, so people will know how you hit the ground running fast too.
Sure. And again, invite folks to call my office, check out our website. We have a lot of great COVID resources on our website as well. But I do sit on the Homeland Security Committee, the Judiciary Committee, which is going to be critical on a number of fronts, criminal justice reform, immigration, and more. I sit on the Environment and Public Works Committee. So this infrastructure package that we're now working on, a good chunk of it's going to be coming through there. We're going to address climate change and invest in our infrastructure. And I also sit on the Rules Committee, so the voter protection work continues, and on the Budget Committee, because it all comes down to budget. But in parting, I just want to thank you again, Congresswoman, for your tremendous leadership and your friendship, and for all your constituents to know we make a heck of a tag team. You in the House, me in the Senate, and all the issues that we care about the most. It's an honor to be working alongside you.
Thank you, Senator Padilla. It's an honor to work beside you. And, you know, I can say this, and you don't have to even comment, but as a member of the House who knows how important it is that we now have the House, the Senate, and the White House, we have to end this filibuster. Yep. We have to do it.
I agree. She used the F word. I agree.
Okay.
Absolutely.
Well, listen, thank you again and have a great week. Thanks all for being with us.
Stay safe, everybody.
Bye-bye.